Hi everyone. In this webinar, we will discuss the comparison of our UUO and adenine models in renal fibrosis and CKD. Also, the model selection application in clinical studies. We offer many CKD models, and we just wanted to give you some insight, comparing two different models, different characteristics of the model, and, you know, as when the client chooses the model for their preclinical needs, what to look for when they decide. Okay, let's see here. Okay, so this one is a UUO model overview. UUO is a unilateral ureteral obstruction model. Model definition and mechanism here. The model that induces the renal interstitial fibrosis in a short period through mechanical stretch and ischemia caused by elevated intratubular pressure following complete surgical obstruction, ligation of one ureter. Pathology timeline: significant fibrotic lesions develop in the obstructed kidney within just 1 to 2 weeks post-surgery. This model is ideal as an acute to subacute renal fibrosis model. Some of the key features: rapid progression, forms distinct fibrotic areas in a short period suitable for screening purposes. The limited functional impact: serum BUN and creatinine levels remain largely unchanged as the contralateral healthy kidney compensates for the function. Some of the key evaluation parameters in UUO model. This model, we focus on pathology, histopathological evaluations of fibrosis. The following parameters are critical for assessing fibrosis severity and drug efficacy. The first one is a collagen deposition by hydroxyproline and serous red, a quantification of total collagen contents in kidney tissue by hydroxyproline assay, also histological assessments of fibrotic area using serous red staining, direct measure of fibrosis extent. Next one is a fibrosis promoter such as TGF-beta 1 expression. The measurements of transforming growth factor beta, the central mediator of renal fibrosis. This is crucial for assessing drug targeting the TGF-beta signaling pathway. The third component is the myofibroblast marker, such as alpha SMA expressions. Evaluation of alpha SMA expression levels by immunohistochemistry or qPCR, those are available, indicates the transformation of fibroblasts into myofibroblasts, the key effector cells in fibrosis. And also inflammation, assessments of macrophage infiltration, FO80 positive cells, also the inflammatory cytokines such as TNF alpha and interleukin-1 beta. Inflammation precedes fibrosis and drives the disease progression in the early phase. And this one, we will look at the background data, past staining of the sham control and UUO. Also the serous red staining in the sham control group and the UUO kidney sample. Tubular injury index is increased in UUO model group. And also the serous red positive area continued increasing from day 7, day 14. Blood urea nitrogen level is also elevated. Kidney hydroxyproline content increases significantly on day 14. We offer ALK5 inhibitor and dapagliflozin as the positive control. Here's a comparison data of body weight, also left kidney weight, tubular injury index. ALK5 inhibitor is significantly inhibiting the tubular injury index. Not so significant with the dapagliflozin. Also kidney hydroxyproline content. Again, the ALK5 inhibitor showing improvement here. Serous red positive area, ALK5. Dapagliflozin is also showing some decreased trend. The next model is the adenine model. This is the overview of the model. C57 black 6 mice is used. Adenine injection is orally once on day 0. The adenine-induced nephropathy model induces the chronic kidney disease pathology through the crystallization of byproducts formed during the adenine metabolism in the proximal tubules, leading to degeneration. The adenine model is characterized by tubulo-interstitial damage, followed by tubulo-interstitial inflammation, fibrosis, and decrease of kidney function, which makes this model attractive for simple proof of concept studies for the chronic kidney disease. Also, hyperphosphatemia and renal anemia have also been reported in this model. There is a possibility to analyze these complications of the kidney disease, chronic kidney disease, using this model. We normally see kidney structural abnormality between day 7-14, and then the functional abnormality will be seen, between 14 to day 21. This is a key evaluation parameters in adenine model. A major advantage of the adenine model is its ability to reproduce the clinical CKD features. This allows for the comprehensive evaluation of renal function, histology, and systemic complications, providing high clinical relevance. The first one is a renal function measured by BUN or creatinine, also protein, urea. Measurements of these serum bond creatinine levels, as well as the urinary protein excretion, directly monitors the decline in GFR functional impairment. Another marker is a fibrosis marker, such as alpha SMA and collagen 1A1. Molecular assessment of pro-fibrotic gene expression by qPCR or protein accumulation is available. Alpha SMA and collagen type 1 are standard markers for tracking fibrotic progression. Lastly, histology, such as pus staining, also serous red. Observation of tubular atrophy, dilation, also 2,8-DHA crystal deposition by pus staining, quantification of interstitial fibrosis area using serous red or Mason's trichromes are recommended. This is a background data, comparison of control group, adenine group in pus staining, also control group and adenine group in serous red staining. Tubular injury index is increased in adenine group, as well as serum creatinine level. Serous red positive area, the fibrosis area is increased. Serum BUN level is also increased. This is a comparison table of UUO model and adenine model. The primary injury site in UUO model, it is a tubular epithelial cells. In adenine model, it is a proximal tubule with glomerular damage. And in UUO model, there is no glomerular damage. Adenine model, they do have some damage in glomerular region. Fibrosis speed, UUO model have a severe fibrosis, and this is a rapid turnaround model. between 1 to 2 weeks. And adenine model, however, is a gradual progression over weeks to months. A renal marker we can use in UUO model is BUN, also creatinine. Adenine model have more comprehensive on top of the BUN and creatinine. We can also check the protein urea. And usually BUN level and creatinine levels are more severely affected in adenine model than the UUO model. Evaluable stage. UUO model targets the acute injury early fibrosis phase up to 2 weeks. And adenine model is more for the long-term chronic progressive renal injury. This is a clinical relevance in each model. So for UUO, model significance such as fibrosis specific evaluation, this model is suited, optimized for elucidating interstitial fibrosis mechanism. Rapid screening, results available in 1 to 2 weeks, advantageous for early proof of concept acquisition. Also, acute targets, this model is suitable for drugs suppressing rapid progressing of the fibrosis. Next, the adenine model is a chronic phase clinical model significance. Here is a clinical relevance point of view. This model reproduces the human chronic kidney disease functional decline and protein urea. Functional outcome, quantitative evaluation of renal function improvement, and complications useful for verifying effects on anemia and mineral disorders are possible with this adenine model. This is a quick chart for the model selection guidelines. So for, let's say, there's 3 different possibilities here. The drug mechanism target point of view. If you are more interested in acute fibrosis phase and your drug's pathway is a TGF-beta inhibition, then our recommendation would be the UUO model. If the target is a renal protection, metabolics, or from anti-inflammatory point of view, the adenine model might be more suited for you. Evaluation and duration. Sometimes timeline matters, and the short-term histology. Usually UUO model have a shorter turnaround time. This model is very quick and 1 to 2 weeks completion, and adenine model does take a longer term. However, you can see function aspect, also the BUN, creatinine, protein, urea data. Target pathology. UUO is purely fibrosis. It is a fibrosis model, chronic kidney disease model. For the adenine model is a systemic chronic kidney disease with a complication, more functional endpoints, systemic complication check, also the long-term efficacy. UUO model is suited for the proof of concept study, screen anti-fibrotics, mechanism, verify the specific pathways, acute phase, quick data turnaround. That's it for today's webinar. Thank you for listening to our contents. Every month, we continue to provide high quality in vivo study, and our core expertise are fibrosis in IPF, that's lung fibrosis, MASH, MASH to HCC with our STEM model, as well as CKD, systemic sclerosis, interstitial lung disease. Those are skin and lung fibrosis disease model, as well as oncology. If you'd like to learn more about our capability, please visit our website, or let's connect with our agent, and we will be happy to talk with you. Thank you.